Alrighty, it's been pretty quiet from the PMV side of things lately, and I'll explain why in another video. And I also apologize for the audio quality as well. I couldn't find my good quality microphone, and like all of my electronics that fit in my pocket, it has gone through the wash. And so is this one. It's not as good. It's not designed to be a microphone. It's designed to record my conversations so I don't forget them. But what I wanted to talk about is actually really important to me because I really struggle to convince people to carry through with this one. The most difficult are actually related to me, and even the harsher side of Stuart doesn't seem to get through. Um, it's something that it's not in your face all the time. Although, having said that, my example is in my face. I'll just get straight to it. My Facebook profile photo hasn't been updated for quite some time because, like everybody else, I haven't found a cuter or more attractive photo yet. But it is of my little dog Reggie licking my face, um, and I say that it's older because it was at a time where her teeth were clean and she did not have bad breath. Bad breath is not normal for dogs. It's an old wives' tale. Like letting your dog lick your wounds if you do not have access to medical help. Um, that one too, I had to honestly um, correct somebody on who really should have known far better, because they have medical doctors and veterinarians and highly educated people in their family and extended family, and yet they well and truly believed that letting your dog lick your open wounds was a good idea. Uh, please don't do that, or do it. I don't care, but it may look cleaner. Anyway, that's a problem for you and your physician, your private human physician. But the point being is that I can no longer let my dog lick my face. I don't condone that at all at any time. It was just a cute photo, so I used it. I don't like being licked in general. Um, it's yuck. It's warm. It's wet. It's not for me. um, I like to be dry and clean. Um, but it's revolting now. My dog has bad breath. Reginald, the ugly thing that is so ugly that it's cute. Please don't disagree. I've convinced myself that makes her cute. And I just wanted to communicate and highlight how important dental procedures are, because historically it's something you don't see. Nobody looks into their dogs' mouths regularly, not even vets. Dogs don't like it. It's not normal. It's weird, and it's not something that people do. However, letting your dog lick you is something that people do, and they think that the bad breath is just normal. Bad breath is only normal in dogs if they've just eaten shit, and they don't eat shit 24/7, so it's not normal. And prophylactic dental work is incredibly important. And I use the word prophylactic very loosely as well, because by the time we, as pet owners, finally get into booking into that dental prophylaxis, and we even in clinic, I shouldn't say we in clinic because I don't work in clinic anymore, but in clinic, it's described as a prophylactic dental scale and polish, exactly the same as what we get done at the dentist, which I'm well overdue for. I actually got a final reminder from my dentist about my 6 monthly prophylactic scale and polish. So I understand we're all human. I'm behind on my own dental hygiene, and I'm behind on my own dog's dental hygiene as well. There are many factors, but one of those factors is cost, and cost is the most common and it's the biggest hurdle for clients to get over in getting their dog's teeth attended to. And the thing is, the longer you leave it, the longer you wait, the more you procrastinate, the more expensive it gets. And I feel the pain. I don't work in clinic anymore, as I've mentioned, and so I can't do it myself at home, ethically. And so I need to use a clinic just like anybody else, and I don't receive any discounts. And to be honest, the cost has been putting it off a little bit for me. Even though it's something that I know that my dog needs annually, basically. Most little dogs will need an annual scale and polish to keep their teeth functional. That smell, the bad breath, is bacteria farting. Basically, what you're smelling is bacteria fart, and those bacteria are feeding off inflamed and infected gums and roots and periodontal disease that you can't see. And it's quite easy to ignore because you only notice it when your dog licks you. And I know that dental care isn't covered by Medicare, so us vets can't use that excuse. Oh, it's expensive, but for humans we've got Medicare. Dental care isn't covered by Medicare, and so a lot of people skimp out on their own dental care as well. However, we brush our teeth every day. Generally, we should twice a day, 2 minutes. And the thing is, with us, we know when a tooth is hurting. You can tell yourself and you can tell others when you have a toothache. And when you have a toothache, the urgency of getting to a dentist has increased and the cost is less of a concern because you're in pain. But do you stop eating because of that toothache? Or do you continue to eat and just avoid chewing on that tooth? Because that's a common excuse. I'll say excuse. Yeah, my dog's teeth are fine, it's still eating. Of course it's still eating. If it doesn't eat, it dies. It experiences hunger first, which I find incredibly painful. But then it will slowly die after it consumes its reserves if it doesn't eat. So it's going to tolerate that toothache through the process of eating to stay alive. And I find that really unnecessary to explain, but from experience, it's something that the general public don't seem to think about and don't wrap their heads around. And I guess that's my job, right? My job is here to speak for your pet. And sometimes when I'm telling clients that in face to face, it can come off as pretty rude and what's the word? Anyway, it can come off as no shit, Sherlock. I can't believe I have to explain this to you. Um, but your pet doesn't tell you that it has a toothache. It can't. We see evidence of it when if we get in there and look at their teeth. Um, Sometimes, just from a physical exam, we can see more dental disease and calculus build up on one side of the mouth. That indicates that side, that dirty side, there's likely periodontal disease that you can't see that is painful because they're not chewing on it. So the way that dogs and cats keep their teeth clean is, get this, is by using them. So by using their teeth, they're abrasing their teeth on whatever they're chewing. If they're not chewing, they're not getting that abrasion. And that abrasion is the same abrasion as us brushing our teeth. So the bristles on our toothbrush are rubbing up against our teeth, shaking off that bacteria. When it gets to a stage where you see calculus as visible, that's revolting, and it's neglect. And if you saw a person like that, you'd go ill, and you definitely avoid them. Or if you can, if you're able to, afford them a dental visit. But dogs can't tell you that, and they're not going to stop eating because of a toothache, because they die if you don't eat. And so they continue to eat despite having a toothache, and they don't tell you. And the dental disease gets worse and worse and worse and worse and worse. And it hurts, and eventually it results in a loss of teeth. Now, I know that people who can't afford their own dental work, say if they have a toothache and they need a root canal, that's expensive, and they can opt to just remove the tooth, which is far cheaper, which is what we do in animals. Because we can do root canal procedures at the dental specialist. We can do a lot of things. The dental specialist can do a lot of things. It just costs similar, more than what it does for a human, because the pet needs to be under a general anaesthetic. My last root canal was incredibly painful, and I begged for a general anaesthetic. And I made the dentist so uncomfortable that she brought in her boss, who just said, Stuart, you just can't take the pain. And it's true. I have a low pain threshold, but looking back at that was unethical, and they did not have consent to do that. And I put my hand up many times, which obviously means nothing. It's just like when you board a plane and they teach you the brace position. That doesn't do anything, because if you're in a plane crash, you're gonna die, whether you're in a brace position or whether you're dancing up and down the aisle. You know what I mean. I'm in a little bit of a mood at the moment, and I'm gonna leave this in because it's real, and that's what PMV is all about. And my colleagues will find it incredibly unprofessional, and that's what makes me stand out. And the point of my story is, get your dog's teeth done. If your vet tells you, oh, those teeth, they could do with a clean, then do it, please. ASAP. Quicker than I can. I'm going to book in Reggie in the next month or so. I find it very, very difficult as a dog dad, because I do not have children. I haven't made that mistake in life yet, thank God. But she is she is all that I have, and it's very hard for me to leave her in somebody else's care all day. Um, and that's true for a lot of owners as well. And I completely understand that. Clinics take good care of your pet when they're in clinic, but you still worry. You still worry. You still want to be there. You want to be that nagging person. I want to be there for every step of the way, but you just can't. You can't. You have to say goodbye to them when you drop them off, and they will give you that look, and you have to go about your day, and then you come back in the afternoon and you pick them up, and then they give you a much better look that makes it all worth it, and their breath does not stink anymore, which is the whole idea. So it's a little bit of suffering for a lot of gain, and there's no suffering on your dog's part. They have a general anaesthetic, they can't feel anything, they have a scale and polish. If you're in a clinic with x-ray facilities, they'll take x-rays to check for periodontal disease that we cannot see from the outside, which is ideal, which is what Reggie gets. And that's not just a one-time thing in a pet's life either. So that's the other thing. Sometimes I can convince clients to get that dental done, but then it's the mindset is sort of like, okay, well, it's a disease, the cure is a dental procedure, and wham, we're done. They're not going to get that disease again, but they do. They really do. They start getting that disease as soon as we stop scaling and polishing. That disease starts again. So it's maintenance. It's not a cure. It's maintenance, and it needs to happen regularly. And most of the time, it's not prophylactic because the disease is already there. Just like Reggie, it's not prophylactic. It's not a prophylactic dental, even though the clinic will bill it as a prophylactic dental procedure if she doesn't need any teeth extracted. Fingers crossed. But the disease is already there. With the pro bit is we've missed that boat. It's sailed. It is now treatment. It is disease treatment, and yeah, we're just being polite by saying it's prophylactic. And polite doesn't help your pet in any way. So clean your dog's teeth. I have come across 3 or 4 people who brush their pets' teeth regularly, successfully. Now, those people are incredibly devoted and dedicated, far more than I am. 1 cat owner and about 3 dog owners, and that is ideal. That's what we're supposed to be doing. But over the thousands of pets I've seen, 3 or 4 actually get that treatment. And I get that. I don't do that myself. It takes a lot of time. It's stressful for you and your pet. It is absolutely possible, but you need to be incredibly patient to get your pet used to having their teeth brushed every day. And that's a whole nother video. A lot of topics I'll mention are a whole other videos. And that's just me, and I'm sick of apologizing for that, so I'm not going to. So the point of the video is just to get the message across that I'm in the exact same situation as you. I need to pay full price for my dog's dental procedure, which is not easy change. It's something that I need to budget for and accommodate for and make changes for. It's not something that I can just do on a whim, like many of you out there, despite knowing it needs to be done every year, right? it's like the excuse that we get about, oh, we can't afford that right now, it's Christmas, Christmas is coming up. um, but what gets me um, is that Christmas is the exact same time every year. um, it's on the same date, in the same month, um, every single year, every 12 months. So I really, that excuse really grinds my gears as well. Oh, it's Christmas, we can't afford that. Well, actually, you can plan for Christmas, because what's the average age of my clients? That's a really difficult and potentially dangerous question. But what, 30, 40 years old, or 30 to 50 years old, you've experienced many, many Christmases over and over and over, um, at the exact same intervals of 12 months apart. So you should be able to plan and accommodate, and budget for that. And it's exactly the same with your dog's teeth. And but it's hard because I haven't done it this time, because there's a lot of excuses, right? Christmas isn't one of my excuses, but there's been a lot of excuses, and I haven't budgeted for it, even though I knew that it was coming. Um, and that's part of being human, right? We are human. No one is perfect. Some people appear perfect, but they never are. You see cracks in that facade very quickly. So yeah, get your dog's teeth cleaned, please. Don't tell me that they're too old. Anesthetic is very safe these days, and you should have done it when they were younger. If you're worried about age, and you've put it off for a long time, well, it was a lot safer to do when they were 7, and now that they're 10 and they've still got the same teeth with the same dental disease, and they still need a general anesthetic to sort that out. The longer we leave it, the worse the disease. The longer the anesthetic, the higher the risk of the anesthetic. So the longer the anesthetic, the higher the risk. The shorter the anesthetic, the shorter the anesthetic risk. So in using that theory, regular, now this needs a disclaimer, what is regular, what interval, can we have 20 short anesthetics a day, and is that safer than 1 3-hour long anesthetic a year? I'm not saying that. I'm just saying that having say a 30-minute general anesthetic yearly is far better and safer for your pet than having a 4-hour long dental procedure once off, to correct all of that dental disease that has built up in that time. Have you ever heard of the saying, it's like pulling teeth? That's self-explanatory. So get it done. This video is just as much for me as it is for you as motivation, and it's putting it out there that I've said that it's important, and it's going to hold me accountable to get it done myself. So feel free, for those people out there who actually can tolerate my videos, not even my mum can, but check in on me in the next month or so and ask me, have I cleaned Reggie's teeth? Because bad breath in dogs is not normal, and they need regular care. If small breed dogs, they tend to, there's multiple factors, as there's nothing is black and white in this world. There's multiple factors, but little dogs tend not to chew as much as bigger dogs, and a lot of that reason is due to what their owners give them, because we don't give big bones for little dogs to chew on, right? But a lot of big dogs will regularly get bones to chew on, regularly, but not little dogs, and that's controversial as well. Which, if you would like me to discuss the pros and cons of giving your dogs bones, let me know, because I'll probably just do it anyway, if I remember. I don't mind that discussion. So, and little dogs tend to get a bit spoiled a bit more. My dog has just eaten roast beef that is beautiful. It just falls off the bone, and it's incredibly soft, and it just melts in your mouth. It doesn't require any chewing. I didn't. Yes, I put it in the oven, but I didn't prepare it. I'm not a cook of any sort. That's what she's just had for dinner. It's not balanced. It's not what she eats entirely. But that's what she's just had, and she's a small dog, and that has done zilch for her dental hygiene. Anyway, book your dog in for a dental check. And then if the vet says they need a scale and polish, do it sooner rather than later. If you would like, well, you need a consultation to find out who or where I would recommend, and who and where I trust with my own pet. That's sacred information, and ask me that in consult. I'll move on to another video now, while I'm on a roll.